As women in America, we take on everything. We are wives, we are moms, we are daughters, we have careers. We juggle so many things. The problem is we're busy taking care of everybody else and don't take enough time for ourselves. Can you guys relate?
Yes. Absolutely.
But now we're taking a break from taking care of others to focus on our own emotional and physical needs. And here to help and to put it in perspective, memorial cardiologist Dr. Bada and primary care physician Dr. Herrera. Welcome, doctors. Thank you for being here.
Thanks. Great to be here.
Dr. Bada, let's start with you. You are a perfect example of this, a successful doctor for more than 20 years and a woman. I imagine you have faced this struggle as well.
You're absolutely right. We as women are so involved with taking care of everyone else that we often neglect our own selves. And so it's extremely important for us to make time to exercise, to eat healthy, and to try and relax and avoid stress as much as we can.
All right, Chris, what stresses you out?
Work-life balance is a huge stress. Balancing work, the teenage daughter, homework, school projects, social schedule, grocery shopping, and errands.
How much time would you say you average into your day?
I have the car pickup line time. Read a little book, listen to some music, play some games on the phone. For me time, really not much, really, truly, which is definitely, I know, an issue for me.
And you're not alone there.
I have good company.
Right.
In my peer group, we have people who, they know that there's something wrong, but they're so busy. And they say, okay, no, I'm fine, I'm fine, I'm fine. And a lot of times, people are afraid to find out what it is. What do you say to the people who have that fear because they're fearing these horrible diagnoses, cancer, or that they have heart disease or something like that? So what can you say to her?
Dr. Herrera, I imagine that women come into your office and perhaps they've been putting these appointments off too long for this exact reason.
I really think that everyone, but particularly women, should have a really good, close, open, very forthright relationship with their primary care physician. And that should be built over time. Like any other relationship, it takes time to nurture, because even though it's sometimes scary to think of what could happen, it's scarier to just ignore it and to just let it go. That primary care physician will make sure that you get all the screenings, all the preventive health care. They'll ask you about your diet. They'll ask you about your stress level. They'll ask you about exercise.
You know, you said the word stress, and that goes along with being busy. It has to do with not having enough time. Stress, we know, can lead to some pretty serious health issues. It does include high blood pressure and strokes. All right, so here's the question. Who here has a history of strokes in their family?
None.
No.
Okay, so chances are if there's no history, then you guys may not be familiar with the warning signs. And doctors, I imagine that this is something that you see as well. Dr. Bada.
For sure, yes. And it's very important to recognize the signs and symptoms of a stroke right away, because if it's treated immediately, there is a very good chance of a full recovery. And the typical symptoms of a stroke would be weakness on one side of the body, difficulty with speech, sometimes difficulty with vision, occasionally strange sensations on one or more sides of the body. So if anybody experiences these symptoms, they should immediately notify 911 and get to the hospital.
All right, so with that said, any questions you guys have?
If you don't have a history of stroke or heart attack in your family, could it be developed in the future?
Dr. Bada?
So the risk factors for both strokes and heart disease are very similar. The most important being smoking, high blood pressure, diabetes, strong family history of heart disease. That means either a sibling, parent, or child who develops heart disease or strokes before the age of 55 years for a male relative and before the age of 65 years for a female relative.
It's important to add also for other diseases besides stroke and heart disease that, again, family history is only one part of the risk category. For breast cancer, colon cancer, cervical cancer, not having a family history does not mean you're protected against those cancers, and that's why it's important to get those screenings.
You know, sadly, every one of us in this room right here has probably been touched by cancer. The Centers for Disease Control estimates that more than 250,000 women died from cancer last year. And for those who survive, cancer treatments can be intense. You know, we talk about losing hair, we talk about losing appetite, but I imagine, Shamina, the emotional effect it has is even stronger.
It's even stronger, and at the moment you're going through something like that, you're thinking about your family, your young kids, your husband, and it takes a toll on you physically and mentally. And I'm here almost 3 years later, a survivor of breast cancer, and I am living my life. And there is life after cancer.
Congratulations. Okay, another question for you. Who here is in their 40s or their 50s? All right, so welcome to this new thing, this new generation, guys. Have you heard the term the sandwich generation?
No.
No.
Okay, well, here's the deal. Nearly half of middle-aged Americans today are sandwiched between a parent over 65 and either a young child they're raising or a grown child they still support. Does anybody here have any questions when it comes to having an aging parent who they need to take care of? Allie.
My dad is suffering from onset dementia, and he's out of state. And I was wondering if there's any suggestions you might have to help me manage his care.
You know, the incidence of dementia is climbing dramatically as we have older and older patients. The risk of dementia, if you're over 85, the incidence is about half. Almost half the patients will have some dementia. It's important, first of all, to make sure that he gets the best care for the dementia. Unfortunately, there's no medication to cure it, but there are some medications that can maybe help slow the progression. It's then important to establish a team of providers, for example, social worker that might help plug them into resources.
Okay, Dr. Bada, I'm going to steer this last question to you. Is it true that red wine and dark chocolate are good for us, right? We want this answer.
Yeah, we hope so.
Definitely.
So alcohol in extreme moderation has some beneficial effects. And when we talk about extreme moderation, for women, that refers to not more than 4 to 6 ounces of, for example, red wine a day, or maybe even just a few days a week. And for men, that number is a little more. It's maybe 2 cans of beer, but not more than that.
What about that dark chocolate?
The dark chocolate, yes. Now, there are some beneficial effects of dark chocolate in terms of memory and, things like that.
Okay, so not all bad.
Not all bad.
Thank you, doctors. Thank you, ladies, for being here. Great advice from everybody and great questions. And remember, all of you ladies out there, make time to take care of yourself. It is truly important.